In northern homes, where there's even one smoker and the ventilation is poor, secondhand smoke can affect everyone, both smokers and non-smokers.
Breathing in secondhand smoke is especially dangerous for babies and children because their lungs are not fully developed. When there's a person smoking in the same room where others don't smoke, the non-smoker is inhaling the smoke as much as the person who is smoking. This causes cancer and other illnesses in the lungs and also prevents the microscopic air sacs to expand. Where children are exposed to cigarette smoke and when the parents smoke in the house, the ears are prone to infections and the children get colds easily. The lungs get mucus in them more often, and also the rhythm of their breath is affected and leads to asthma. More children are affected by asthma where cigarette smoke is present than children in a non-smoking environment.
For smokers who begin smoking at a young age, they end up more seriously damaging their lungs than if they started later on. The same thing is true for children who are exposed to cigarette smoke in the home, that there can be, even without the infections, there can be irritation to their airways that can have long-term effects on their lung function. It's also true that a baby who's exposed to smoking through the mother during the pregnancy, for some reason, that affects the lung development. I mean, obviously the baby inside isn't breathing the mother's smoke, but somehow the nicotine in the mother's blood affects the development of the lungs. And that again can have long-term effects on that child's lung function.
Babies are affected in houses where there is smoking. The little baby's lungs get dirty. With newborns, smoke affects their lung development, since their lungs aren't fully mature when they're born. When there is smoking in the house where a baby is present, some of the effects that begin to show involve the baby's breathing or the baby is sick much of the time. The kids or babies get sick a lot and are affected with asthma. What is it? They have trouble breathing and cough a lot. Babies get earaches and have a lot of phlegm because of smoky air. That's how smoke can affect babies.
baby kul ila sago se ulwati lo siu se khattale se mutaqo tukko yallo amma nuba go yena yang tuti takwa tamasimu sikala pujolonga atukta gutau nguyena tuwe.
When a woman is pregnant, it is very important that she doesn't smoke. Some of the chemicals that are produced by cigarettes can be passed on to the unborn baby. Once an unborn baby is exposed to these chemicals, it may lead to early delivery, low birth weight, and a variety of birth defects.
Most smokers begin to smoke in their teens. Although many youth start smoking to fit in, to be cool, they don't realize how quickly they can become addicted to cigarettes. Yes, I smoked when I was younger. Even those who smoke.
I started smoking when I was 10 years old because my friends pressured me to smoke.
Yes, I do smoke. No wonder, because my family smokes.
Most of them smoke cigarettes because their friends do, and if you do smoke, you're not bothered.
Young people are beginning to smoke at an alarmingly young age. Fitting in and peer pressure are the main reasons for tobacco use. For most children, family members smoke at home, so they are exposed to the habit from a young age. It's important for young people to have non-smoking role models. Perhaps looking to our elders for guidance and encouragement will help change our attitude about smoking when we're trying to quit.
Tamakwato inna tukait inna lariu yutsanga yunatiami yatigo kanukan ubatin ikayukun ng mangata tamaksimiga tabaki yumid nukakasupadliat iluta.
I used to smoke cigarettes. Now, I think they're bad. I think that tobacco is bad for your health and lungs. I know I was healthy until I started smoking. When I was smoking cigarettes, I knew my health had deteriorated. When I quit cigarettes, I was coughing a lot, and I was told by a doctor to quit. And now I don't even like the smell. I know that cigarettes are bad for the lungs. It took a long time to clear my lungs after quitting smoking. A lot of old mucus was coming out of my lungs for a long time. A lot of long cigarette butts are out along the roads where kids pick them up. Nowadays, tobacco is everywhere. Ashtrays, streets, and kids just pick them up off the ground. I know because my grandkids are smoking, and it's bad for them when they're coughing. If Inuit don't smoke as much, it's better.
Quitting smoking is tough. For some, it may take a number of times before they quit. But don't give up.
1992
In 1992, I tried quit smoking, but it was too hard. I didn't succeed, but I still smoke now.
I worry when I don't smoke. Smoking clears my mind. It calms me down, so I don't try to stop. If you've ever tried to quit, you'll know how hard it is. Some people may feel nervous, edgy, irritated, or depressed, and many people really crave cigarettes. But the good news is, all those symptoms will go away.
For those who want to quit, there are many methods available. If you would like help quitting, visit your local health center. Your community health worker or doctor will help you find the method of quitting that best suits you.